Working as healthcare professionals brings us deep satisfaction and lasting rewards. We are drawn to helping and caring for others and making a positive impact on the world. Most of us are called to our professions for very personal and meaningful reasons. Unlike many other occupations where work can be left at the door, helping is often a part of our identity. Many of us feel that we are doing what we were born to do, and that our work is just a natural extension of ourselves. It can even feel sometimes like a form of spiritual service. We pride ourselves on our compassion, our strength, our skills, our judgment. We enjoy the challenges and the variety of our work. At the hospital, it truly is never a dull moment. Our greatest strength can also be our greatest vulnerability. There can be emotional, interpersonal, and professional risks connected to our regular exposure to the pain and suffering of our patients. Few of us, however, really slow down and take time to consider the emotional impact of caring and the price of compassion. Physician and scholar R.N. Remen writes, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. Many of us operate under this unrealistic expectation. Every day we put on our emotional armor and go fearlessly into battle against heart attack, stroke, cancer, tragic accidents, and mental illness. At our core, we understand that helping others is a great privilege, and we easily welcome the sacrifice it takes. It truly is our kuleana. My hope today is that we can begin to acknowledge this risk and take better care of ourselves and each other." The main difference between burnout and compassion fatigue is exposure to trauma and suffering. People who work in restaurants, stores, businesses, and institutions can all experience burnout. Professionals in the healthcare industry, along with other professionals such as first responders, law enforcement, clergy, and child welfare workers, are more at risk of absorbing the experience of their patients' trauma. Both compassion fatigue and burnout take time to set in, but when considering the difference between compassion fatigue and burnout, one expert phrased it like this: "We are not referring to the most difficult story you have ever heard. We are talking about the thousands of stories that you do not even remember hearing." So how serious is compassion fatigue? Well, we all know stress is cumulative. In their book, Overcoming Compassion Fatigue, Martha Teeter and John Ludgate cite various research studies. It's estimated that 13% of the working population suffers from burnout. The prevalence of compassion fatigue, however, is much higher among the helping professions. 79% of hospice nurses have moderate to high rates of compassion fatigue. Half of child welfare workers are severely impacted, as are 54% of medical residents. Even American surgeons indicate that they think about suicide 1.5 to 3 times more than that of the general population, and yet only 26% of those who thought about suicide sought outside help or support. We must do better. In the next couple of slides, you will see the rate of compassion fatigue in different professional groups, as well as the incident of burnout. Look at what happens for emergency room nurses. About a third meet criteria for compassion fatigue. However, 85% have experienced some symptoms in the past week. And look at the incidence of burnout among physicians. It's very important that we take care of ourselves and do things we enjoy and love. Most of us will look at these statistics and adamantly deny that we fall in those numbers. We can be literally drenched in suffering and still think that we are dry. Now, many of the symptoms of compassion fatigue can be transient and can be handled with self-directed interventions. However, compassion fatigue and burnout can become more serious and complicated and difficult to manage. Stress and burnout can lead to conditions that impair our ability to function, to work, to love, and to play. If you are starting to feel overburdened, or indifferent, or ineffective, seek outside support. Seek the counsel of someone you respect and trust. If you want complete confidentiality, find out more about your EAP program. But whatever you do, please don't minimize. You know, compassion fatigue can get tricky. Sometimes we feel guilty that we do not fully understand our patient's trauma, and then sometimes we feel guilty for the interventions we must put our patients through. Avoid all or nothing thinking. It is important that we have a balanced view of our patients, not just as victims or just survivors. Even master therapist Carl Rogers, whose approach highlighted therapist empathy and unconditional acceptance, cautioned against simple emotional shadowing or feeling bad because the patient does. It is my hope that by acknowledging compassion fatigue, that we can start talking more openly with each other. It is also my hope that we can continue to learn from each other. We have a wealth of talent and diversity in our hospital, and it's through more positive peer relationships and connection that our own opportunities for self-care and resilience can emerge. Be well, and thank you for listening.